Welcome, brothers and sisters, ladies and gentlemen, to Black World TV, the new black media, your black and intelligent news source. Today's video broadcast is about prisoners at Rikers who say it's like a death sentence as the coronavirus spreads. Best believe that this story I'm about to read to you pertains to most all other jails and prisons across the United States as well. If you have family members or if you yourself have experience going to jail or to prison in the United States, then I'm sure you'll be able to relate to this story and have empathy. So, Junior Wilson is worried the coronavirus could kill him. The 57-year-old relies on a pacemaker to keep his heartbeat regular and could have trouble breathing if he catches the virus. But unlike many Americans, he can't isolate himself or disinfect his hands with sanitizer. For the past 7 months, he's been held on Rikers Island for a parole violation in an infirmary unit filled with people who have health issues. Wilson says he sleeps in a bed a few feet away from men who are constantly sneezing and coughing, and that new people are arriving on his floor every day. Nobody is removed unless they test positive for COVID-19, the disease caused by the coronavirus, giving the virus plenty of time to spread before the results come in, according to Wilson. And that is the truth. On Wednesday, Wilson developed a cough, sore muscles, and diarrhea, symptoms that have not gone away. He and the roughly 28 others in his section threatened to go on a hunger strike if they don't get masked. Quote, "They give us nothing to protect us," he said of the staff at Rikers. "I just feel like I'm sitting on death row, waiting to die." A jail on Rikers Island is one of the most dangerous places to be as the coronavirus outbreak spreads. The rate of infection in New York City's jails is 7 times higher than the rest of the city and 87 times higher than the U.S. overall, according to data analysis by the Legal Aid Society. Quote, "If the daily COVID-19 infection rate remains this high, the virus will engulf the entire local jail population in a matter of weeks," the group said in a statement. New York City's Department of Corrections won't say how many confirmed COVID-19 cases there are at Rikers Island, but as of Friday, 103 incarcerated people and 80 staffers in the city's jails had tested positive for the disease. A New York City Department of Correction investigator who had tested positive for the coronavirus died last week. Jails are high-risk environments for contagious disease. It is impossible for most prisoners to follow recommended guidelines on social distancing, hand washing, and disinfecting surfaces. Incarcerated people usually sleep, eat, shower, exercise, and use the phone within a few feet of other people. Medical care in jail, even under regular circumstances, is often poor. Conditions at Rikers Island, the second largest jail in the country, are notoriously bad. Several prisoners told reporters they are forced to sleep within a few feet of people who show symptoms like coughing and fevers, and said they can't get masks, gloves, hand sanitizer, or cleaning supplies to protect themselves. Some don't even have ready access to running water or soap. Well, let me stop right there. These are prisoners. These are human beings. These are our family members. This is you and I. We should be concerned. These people who are doing time don't necessarily are doing time for crimes that they've committed. There's other YouTubers who have covered this. One in particular I can state Michi X, she's covered prisoners who are in jail, or people who are in jail who don't necessarily belong there, and even so, they too are human. They should be treated humanely. So on that notion and on that point, let me just say that it's tough for all of us to get masks, gloves, hand sanitizer, and cleaning supplies to protect us out here in the world. So, even though this article states that about inmates, and I understand that perfectly well, you and I understand that perfectly well, we're still concerned for them too. But I know that that kind of condition, being in those conditions where you're next to people that you can't escape from, and they're coughing and hacking and sneezing around you and showing signs and symptoms of the coronavirus, what can you do when you're in jail? But anyways, it could take up to 2 weeks to get medical attention, and people with COVID-19 symptoms are often not being tested or having their temperatures checked, according to a recent report from Brooklyn Defender Services. In fact, corrections officers pepper sprayed 8 prisoners earlier this month after they tried to go to a jail clinic to get their temperatures checked. So, basically, you heard what I said. Corrections officers pepper sprayed 8 prisoners earlier this month who tried to go to the jail clinic just to get their temperatures checked. This is the state of our prisoners, of our family members, of our loved ones, of people we care about in the jail systems, in the correctional systems. This is what they have to deal with. Corrections officers who are pulling a check and treating people inhumanely. That's a problem. New York City officials voted last year to close Rikers, which has become infamous for prisoners' abuse and neglect, and replace it with smaller, more humane facilities by 2026. But those plans have been interrupted as Department of Corrections officials scramble for space in the overcrowded jail to isolate sick prisoners. Earlier this week, the department reopened the Eric M. Taylor Center, a building in Rikers that had been shut down in March, to use as an overflow location for incarcerated people showing signs of COVID-19 infection. Legal Aid Society has filed multiple lawsuits arguing for the release of prisoners who are elderly, which is right, have health complications, which is right, and are being held in pretrial detention, and who are being held for low-level violations. And that's true and correct. They should be looking at that, but they should have done that already. The group secured some victories, but thousands of people are still sick at Rikers, waiting for the highly contagious virus to hit them next. Quote, "We keep talking about New York City being the epicenter of all this in the U.S., but the truth is the epicenter is our jails and prisons," said Kelsey DeAvila, the project director of jail services. "I think death is inevitable. These are deaths that could have been prevented," unquote. Wilson, the man with the pacemaker, is being held at the North Infirmary Command Center, or NIC, a unit on Rikers with 150 beds for people who need medical care and another 260 beds in special units for people who need protective custody. NIC detains the most medically vulnerable people, including those who are over 50 with heart disease, high blood pressure, diabetes, and asthma. People in Wilson's unit sleep a few feet apart, eat in groups, and share a bathroom with about 30 people, he said. Now, the NIC also holds people who have coronavirus symptoms. Most people in Wilson's unit have been tested for COVID-19, but new people with symptoms show up every day. Quote, "You don't know who is positive or negative," Wilson said, adding that he woke up on Wednesday to find 4 new people in his dorm. Prisoners with symptoms are only transferred out of the NIC and put into quarantine after they test positive for the virus, something that has been happening daily, Wilson said. That means that the prisoners at Rikers who are the most at risk of getting very sick from a coronavirus infection now have an even greater chance of getting the disease. COVID-19 is going to hit Rikers like a freight train, Wilson said. There's no ifs, ands, or buts about it. New York City's Department of Corrections wrote in an email that it is ensuring there is an empty bed in between people in custody to increase space while sleeping. But where it is not practical, Department of Correction is utilizing head-to-toe sleeping arrangements for people in custody in dorm areas. William Jones, a 58-year-old detained in NIC, said people in his unit are walking around sneezing and throwing up. Jones has a heart condition, asthma, and type 2 diabetes. Quote, "We have been sacrificed by the state," he said. "Eventually, we're going to catch the virus and die." Marvin Watson, another man held in NIC, said he had been walking around in the yard with a guy who tested positive for the coronavirus and was quarantined 2 days ago. Quote, "It's really kind of mind-wrecking stuff," said the 53-year-old with diabetes, "to not know if you're going to catch it." Even as coronavirus spreads throughout Rikers Island, the Department of Corrections continues to bring additional prisoners into the jail complex. You would think, family, at this point in time that they would try other methods to stop bringing in people into the jails at this moment. You would think that they would try many other methods to try to quell this virus, this outbreak, this pandemic. But as it reads, they're still continually bringing in additional prisoners. On Monday, approximately 24 men were transferred from the Manhattan detention complex to Rikers. Sean Hernandez, one of the men in the group. When the men arrived at Rikers, it was clear their cells hadn't been cleaned since the previous group of men had been moved. They were filthy and there was garbage everywhere, Hernandez said. Hernandez, 33, is currently working through an appeal in his case, but his next court date has been postponed as the result of COVID-19, and he doesn't know when he'll have a chance to appear in court. He wasn't aware of any confirmed COVID-19 cases at the Manhattan jail where he was previously held, and he doesn't understand why he was moved into a facility battling an outbreak. Quote, "I personally have asthma. This could be a death sentence for me," he said. Hernandez requested anonymity in a previous story, but has since agreed to be named in hopes of raising awareness about the unfolding crisis at Rikers. Without access to gloves or masks, prisoners have started wrapping their faces in towels, sheets, and sweaters in an effort to protect themselves, Hernandez said. He has repeatedly asked for gloves to clean the showers, a job he is required to complete 3 times a day. "We're being treated like second-class citizens, like animals," Hernandez said. "I just want people to know, in case something happens to me, I could drop dead." The Corrections Department claimed in an email that masks are provided to incarcerated people who are symptomatic and to those who live in a housing area that is exposed. Quote, "To me, we were safer in MDC," Damani Thomas, another prisoner who was recently transferred to Rikers, said in an interview. "We had soap, sinks, the showers worked, everything was clean. At Rikers, the sink in his cell doesn't even work." Hernandez and Thomas said it is impossible to put any distance between themselves and other inmates. They are served food by another prisoner who does not have access to gloves or a mask. They eat at crowded tables. They suspect the house next to theirs, about 15 feet away, includes people who are sick. They have both seen people in hazmat suits approach the neighboring house. Quote, "We're just in this house waiting to die," Thomas said. Mayor Bill de Blasio has said the city will release nearly 400 people from jail this week as part of the effort to minimize the spread of the virus. That move is too late, D'Avila from Brooklyn Defender Services said. To save lives and prevent the spread, the city needed to have let out thousands of people by now. Quote, "We're going to see deaths, and all of these could have been prevented weeks ago," unquote, she said. Quote, "This all could have been prevented." Now, family, I'm going to stop right there, and I'm going to agree on this last point for sure. The mayor and all these politicians who we've voted into these positions have been failures. They haven't been called to task the way they should. They haven't been accountable or responsible for their lack of action. And as this person says at the end, that we're going to see deaths and all of these could have been prevented weeks ago, is a true and correct statement that none of these politricksters can deny. None of them. And so, lastly, I'm going to leave this video off by saying that there was another article I saw today where a top Chinese health official warns not wearing a mask is a big mistake. I say that because there are plenty of people out here in the world who are pushing that narrative that, well, the masks really don't do much. Well, the masks, they don't really cost, they don't stop anything, and this, that, and the other. I would say to you that you need to tell those companies that produce the mask in the first place, I need for you to make that argument with them. They've been making these masks way before this virus came along. How come people haven't been using that same argument before now? So, again, I leave you off here on my channel, here at Black World TV, the new black media. I ask that my brothers and sisters out there of intelligence to use whatever protection you can. That includes masks as well. Don't let people tell you that they don't work, that they do nothing, because they do something. So, thanks a lot for your time. Thank you for watching. I appreciate it. Give this video a like, thumbs up, share, and if you haven't already, please subscribe. We'll see you in the next broadcast. Black World TV, the new black media, your black and intelligent news source.